Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is November 20th, 2025. This video is on a New England Journal of Medicine article titled Evolocumab in patients without a previous myocardial infarction or stroke. There's an accompanying editorial titled VESALIUS and the Anatomy of High-Risk Prevention. Evolocumab, a PCSK9 inhibitor, reduces MACE, major cardiovascular events, in those with prior myocardial infarction or stroke. However, the effect in those without prior events was unknown. So this study, which is titled VESALIUS-CV or VESALIUS Cardiovascular, was an international double-blind randomized trial. The study cohort comprised of 12,257 patients. The population included no prior MI or strokes, age between 50 to 79 in men and 55 to 79 in women. Those with atherosclerosis or high-risk diabetes were included. Follow-up period was 4.6 years. Therapy, Evolocumab 140 milligrams every 2 weeks versus placebo. Lipid profile of the cohort, LDL cholesterol was 122 milligrams per deciliter. 92% were on lipid-lowering therapy, and 72% were on high-intensity statins. What did they find? A 3-point major cardiovascular events was 6.2% in the study group versus 8.8% in the placebo group. Hazard ratio 0.75, p-value less than 0.001. The 4-point MACE was 13.4% versus 16.2% in the control group. Hazard ratio 0.81, p-value 0.001, less than 0.001. There was a 36% lower risk of MI. LDL cholesterol change was about 55% at 48 weeks. The median LDL cholesterol was 45 milligrams per deciliter, so less than 50. Limitations: is a predominantly white cohort. There's variable statin intensity. The hierarchy restricts inference or secondary endpoints. Key takeaways: Evolocumab lowers first event cardiovascular risk. LDL cholesterol lowering to 45 milligrams per deciliter is safe. The accompanying editorial, the core message is that VESALIUS-CV expands LDL lowering prevention to high-risk patients without prior MI or stroke. Key insights from the editorialist: Evolocumab reduced 3-point MACE by 25% and 4-point MACE by 19%. LDL cholesterol fell to 45 milligrams per deciliter versus 109 milligrams per deciliter in the control group. The risk reduction mirrors non-LDL biology, and the trial population reflects high cardiometabolic risk. Limitations: there was low utilization of ezetimibe and GLP-1 or SGLT2 inhibitor use. Generalizability to fully optimized therapy remains unclear. The key takeaway: strongly supports for aggressive LDL cholesterol lowering in high-risk primary prevention. Key clinical pearls from the study: LDL cholesterol reduction magnitude predicts cardiovascular risk. The benefits are consistent across all subgroups. The event curve continues to diverge over time. Evolocumab complements optimized statin therapy. It supports LDL targets below 55 milligrams per deciliter. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.